Today, the city started mass testing for the coronavirus at the State Fairgrounds. Mayor Duggan just announced the process went so well today, they plan to expand to 400 people tomorrow. But you can't just show up and get tested, and this is important. We want to go live to our Heather Catallo. She has the very latest on this. Heather?
Yes, Dave, it's really important. You have to make an appointment, but before you do that, you need a prescription from your doctor. And as we found out today, that's not so simple.
On the TV, it makes it look like you can get tested, but you can't.
Jim Sarah says his wife Dina began showing symptoms of COVID-19 last week. They tried to get tested at Beaumont Hospital, but did not meet the high-risk criteria. So they wanted to get tested at the State Fairgrounds, but their doctor said she could not write a prescription.
Doctor calls me back, says you can't go. They're asking the doctor the same questions that we went through the screening at Troy Beaumont. You know, is your patient on kidney dialysis? Does he have? Is he taking chemo?
The Sarahs are not alone in their failed quest for a prescription.
In a perfect world, if we had extensive testing capacity, we would test everybody. That's the way you would do a broad epidemiological analysis. But unfortunately, we're not in that space right now.
Dr. Phil Levy is an emergency department specialist at Wayne State University. He says in order to write prescriptions, doctors must meet the high-risk criteria set by the state of Michigan.
Priority 1 testing includes symptomatic healthcare workers. Priority 2 testing includes things like age greater than 65 and comorbidities. And again, you're trying to identify those folks, not just who have the disease, but those who are most likely to develop adverse consequences. So they're trying to be judicious in a time of testing limitation.
That means the new State Fairgrounds testing site is not as accessible as you might think.
From Mayor Duggan's perspective, he's correct in the sense that just get a prescription from your doctor. From the doctor perspective, it's more of a burden on them to ensure that the individual being given the prescription meets one of the priority criteria.
For the Sarahs, that's causing even more stress.
It was giving my husband a lot of anxiety because neither of us know where this is going. Is he going to get sick?
Dr. Levy says if you feel sick, just stay home.
The most important thing for people to know is that the majority of people who get COVID are going to do okay, actually do well. And so being diagnosed or not diagnosed is not going to change that because there's no medicine we can give you right now that definitively improves outcomes.
Now, for mild cases, Dr. Levy recommends getting a lot of fluids, a lot of rest, trying Tylenol. But once again, if you are able to get that prescription from your doctor, you need to make an appointment for the testing at the State Fairgrounds. We have the phone number for that. It's 313-230-0505. So please call ahead. Reporting live, I'm Heather Catallo, 7 Action News.
Really important information there, Heather. Thank you.